So Dr. Belmaker, you've spoken about the importance of steadiness in treatment and consistency in treatment to maintain stability. And among some people, there's a real resistance to taking medications. And many people seem to hate psychiatric medications. What would you say to that whole issue? Is that a challenge that comes up in your clinical practice? And what are the risks of not taking medications? Do you have maybe a case you could share with us, or some anecdotes that would help us understand that?
Well, I think it comes up every clinic. And as you say, there is some culturally determined aversion nowadays to medicine and to psychiatric medication in particular. And the internet is full of advice of people who say to people to stop their medication. With my 40 plus years of experience, I can tell you that unfortunately most patients who decide to stop their medication have terrible relapses and pay terrible prices for accepting this cultural misinformation. Now, that isn't the case with everyone, and I would not want to say that that's 100%. There is 5 or 10% of patients who've had a manic episode and who never have another one and can stop all their medications. But we don't know who they are. So medicine is a matter of statistics and chance. And as a physician, I advise people strongly not to stop their medication. I do not promise people that there will be no side effects. Unfortunately, almost everything we do as we live has a side effect. There is no job that is perfect. There is no marriage partner that is perfect. And there is no medical treatment that is perfect. And we need to work on all of these all the time. But the evidence is overwhelming that people with a diagnosis of bipolar disorder do much, much better in the long run if they take their medication. Often they can simplify their medication regime. People should tell their doctor, perhaps not 3 times a day, can I have it in the morning and the evening? A doctor can find a way to make the medication more simple, perhaps not 4 different kinds of medication, perhaps 2. This can be worked on, but patients with bipolar disorder need medication.